Welcome. Good morning, afternoon, evening, and even tomorrow for some of you. I am William Neece, Director of Airport Solutions for Ozion, and also the Conference Director of the Airport PRM Leadership Conference. I would like to thank all of you for taking the time to be with us today. I would also like to start right off by thanking our entire team for all the hard work and dedication to hosting these very important Airport PRM Leadership Conference webinars. In particular, Kevin Knight, who has once again done such a wonderful job of pulling together all of the content and then delivering it back in such a succinct and professional manner. We are all now well into the COVID-19 pandemic. It seems we are seeing the light at the end of the tunnel, as it were. We've seen many airports around the world come to a complete or near to a full stop. And now, luckily, more and more are beginning to add flights back to the schedule. As everyone here knows, assistance for passengers with reduced mobility in airports is an incredibly focused area with its own massive challenges and structural particularities. It is in this area that we and our staff all engage in every day, from the front line serving each passenger to dispatching, planning, and management. So it is in this area of our combined expertise and real-life challenges that we will focus our sharing of knowledge today. On the bottom of the slide, you will see an example of a question that was asked in our current COVID-19 PRM recovery survey. In addition to looking at the impacts felt, we were also looking towards recovery. The example shows that both airports and service providers are cautiously optimistic in seeing the turnaround reaching close to normal activity, hopefully within the next 12 months. The feedback from the survey and added best practices around reopening safely has been absolutely fantastic. Thank you to all of you who have submitted your thoughts and submitted the survey. It will stay open for a couple of more days. So those of you who have not filled it out, please go to the blog and fill it out. And we'll have the link up for just a couple more days, and then we'll send out the survey, a link to the survey early next week. On another note, the Airport PRM Leadership Conference has now entered its landmark 5th annual edition this year. And we are going to move forward with the November event in an interactive online environment, most likely spread out over 2 to 3 days, and as in previous years, with featured speakers in all of the areas of service delivery for passengers with reduced mobility in our airports. And as per requests from previous years, we will also be expanding the sessions to have more focus on the PRM Manager software suite and a new focused exclusive PRM Manager user group session as well. So please look for more information coming out very soon in our PRM newsletter on the conference. We are very humbled by the number and diversity of all of you attending today. You are joined by airports, service providers, airlines, authorities, advocates, trainers, industry association representatives. We have regulators attending from both Europe and the United States, private companies, and airport operators as well. Overall, we have reached over 23 countries in attendance today, reaching as far as Costa Rica, New Zealand, Gambia, Japan, and everywhere in between. A little housekeeping. Please make sure that all of your cell phones are on silent. That is my own personal little joke that I can't hear any of you laughing to because you're all on mute. And you will be on mute throughout the presentation. After the presentation, we will have a time for question and answer. You may press the raise your hand button on the upper right-hand side of your screen. And we will unmute you and you'll be able to ask those questions directly. So with that, let's get started. Today, our featured speaker is Laurel Van Horn. She has specialized in accessible travel and and hospitality since 1987. For the past 16 years, she's been the director of programs for Open Doors organization, the Chicago-based nonprofit best known for its nationwide, really international wide studies of the disability travel market. In addition to developing customer service training for airports, airlines, and service companies, Laurel also contributes to numerous projects for the Airport Cooperative Research Program. Ladies and gentlemen, please join me in welcoming Laurel Van Horn. Laurel?
William, for some reason, again, the slides aren't advancing, so can you help on your end for the moment?
Yeah, you go ahead and get started, and I will start on my end.
All right, thank you, William. Thank all of you for attending. It's a very august group. You'll all be receiving a copy of the slides today, as well as a recording of the webinar. As usual, I've packed it full of material, and I'm going to be going through things quite quickly. I'm sure today I'm going to raise more questions than I answer, but for me, this is all about encouraging people to think, discuss, and really consider what we can adopt to improve things for the future. We're coming from a period where we really couldn't keep up with demand to one where now, there we go. I did it myself, William. I think I'm good. Where we came down to nothing. And now as we build up again, how can we in future do a better job to assist these customers with the care and the dignity that they deserve? So we're really talking about recovery now, and not where we've been in terms of the massive crash of demand. So William already said a few things about Open Doors organization. What we really do is work closely hand in hand with all the stakeholders in aviation. We work in other areas as well, but aviation is our main focus. We do a lot of training for airline service companies and so on. We cooperate with ACI to do a workshop several times a year. It's a 3-day sit down, get down into the weeds with everybody. This is a photo of one that was held in Houston. We're in the field right now doing our 4th nationwide study of adult travelers with disabilities. We're going to include some COVID-19 questions in that as well. So to judge where the market is going. So yeah, we're going to start with the bad news. Of course, there was a massive crash in demand. Layoffs were up to 80% for the companies in the United States. Carriers also, of course, hit rock bottom. They also had to let people go if they were handling the PRM service themselves. Now, let me note first of all, I don't usually use PRM. It's not a term we use in the United States. We usually say passengers with disabilities. So key service changes, same in US as elsewhere. We're trying to sanitize our equipment, after each use. That includes the wheelchairs, the electric carts, whatever we're using to assist people. Our personnel are wearing masks, sometimes gloves. We're making sure that the people who are working at the airport are healthy through temperature checks, through interviews on a daily basis. Hand sanitizers are now available everywhere. People are now required who are traveling to come in with masks, or they will get masks at the airport to use, and on the planes as well. Some of the airlines are now requiring that. We're a little late in the day, I have to say, in making those changes. And now some airports are also doing temperature checks. So for people with disabilities, of course, the impact has been worse than for the general population. They're disproportionately affected, more severe symptoms, higher mortality, and that includes also older adults and people with chronic illnesses. Certain parts of the community are, of course, have a worse impact. People with hearing loss, it's really difficult to communicate if people are wearing masks, or you can't get close to anybody. People with vision loss have trouble social distancing. They're very worried because they can't see who's wearing a mask and who isn't. And of course, if you need a sighted guide, it's hard to do that at a distance. I'm going to talk more about how we can better assist those customers. For people with autism, dementia, sensory processing disorder, they can't necessarily even wear a mask. They may not be able to tolerate it. And of course, any change in routine is completely thrown a curve to those people. Mental illness, Quarantine and isolation have led to greater depression and even suicide within the United States. And of course, these people are going to be even more anxious when they get back out to travel. So to date, the only survey we've seen among travelers with disabilities was from Easy Travel Seat. And I'm going to talk in a little bit about what their product is when we talk about slings for transferring people in and out of airplane seats. So it was conducted this May with people with disabilities from Europe, America, Asia, and Australia, New Zealand. Most of these people were really frequent flyers before COVID-19. 70% had flown more than once a year. That's really above average. This is not a scientific survey. He just put it out on the web and invited people to answer. But at least it gives an indication of what these travelers are thinking about and when they plan to start traveling again. So for half, they're planning to wait 6 to 12 months. That's not surprising. That compared to 40% in the IATA survey. And most, are going to, 29% said that the finances were not going to delay them traveling versus 69% in the IATA survey. So that's really good news and surprising news. And then also most are going to be willing to fly internationally. And of course, this is mostly a European study, so that's not too surprising in that sense. It's not like they're coming out of America or Australia. And then, while 1/3 said they're not going to fly before the vaccine is ready, 2/3 are willing to fly or are unsure. So this 70% is the people we want to try to reach out to and convince that it's time to get back in the skies again. So the main concerns of these respondents, pretty much what we're all thinking about: the lack of clean air in the cabin, worries about social distancing, being in confined spaces, being around strangers. One thing that's different is, of course, those who are requiring the special assistance, and they're concerned about how do they access this help getting through the airport. Getting close to strangers, is something that people have really been trying to avoid. Seats on the plane, redesign of seats is also an issue. A lot of times the wings they're putting up to prevent people from breathing on each other are now making it difficult to transfer in and out of the seat. So this is a problem. And again, we're not paying attention to everybody's needs when we do that kind of design. So again, the key takeaway, we need to boost these people's confidence in order to get them back out traveling again and to reassure them that it is safe for them to do so. So when I look at the different organizations around the international aviation organizations, they're all saying the same thing, namely that we need to accommodate everybody as we open up again. This is an issue because not everybody, as I mentioned, can wear a mask. If somebody needs to enter the terminal or be met, a lot of the terminals now are saying nobody can come in if they're not flying. So again, we need to make an exception for these people. And if you see this picture on the right of the block seats at London Heathrow, there's very few seats to use. And of course, this is a big issue for people with disabilities, for older adults, but also anybody traveling with a family member or a caregiver. You can't sit together. So this is something we need to look at again. Practically every seat in this picture is blocked. So how are we going to accommodate these needs? What training are our frontline staff receiving to understand that there are exceptions to the rule? What kind of information are these people getting before they arrive to the airport? Pre-trip messaging, online services that you can book are really important, more important than ever. Of course, the first thing is the accessibility of the websites and meeting international standards. A second thing is the content and how you're organizing the site to make it easy for people to find what they need. In ACRP Report 210 on innovations for travelers with disabilities, we included a whole chapter on pre-trip planning and web content best practices. And I definitely refer you to that chapter when looking at, what's missing on your own websites. So obviously now we need to add the COVID-19 messaging as well and make sure that it's going to address all the different disabilities, not just mobility, but also the hidden disabilities and sensory disabilities. So now that airport familiarization tours, which are quite common in the US, are suspended, can we add a social story to help families prepare for a future trip? If we're putting on videos, which are always a great idea, then we have to make sure that they are captioned so people who can't hear are not missing the information. And then, of course, pre-book services are going to be more popular than ever. I see more and more airports adding them. Prepaid parking, valet parking. You can, check your bags in from home and have them delivered back to your home. Again, a great service. And now I recently saw an article that's now suggesting even appointments for security, so that people can get just-in-time service and not wait on a queue. And this is a trial was already done at Amsterdam at Schiphol in 2017, so maybe we'll see this actually being now offered by different airports. And of course, social media, it's great for input from customers and also a great way to get the message out. In terms of arrival check-in, I want to talk about a few best practices. All of the international organizations are saying it's best to have people check in online and before arrival to the airport. That way, you can move people much more quickly and minimize queues and crowds. So one of the things that we always look for is, can we create a separate route for people who need assistance versus the people who have their boarding pass, maybe just need to drop a bag and can go quickly on their own to security. By doing that, we're keeping our customers with disabilities much safer because they're being exposed to fewer people. The other question is really, how can we streamline the check-in process? This is especially burdensome in the United States because there you get met by somebody from the service company, then they have to take you to the check-in counter. It's because the airline insists that people come to check in, and then you get handed back to the service company, and generally you sit in a holding area and then finally go to the gate. So can we streamline the process? And through shared use of software is obviously an important part of this, so that the person can be met by the service company, assisted by them to complete whatever the procedures are, and then taken to security and to the gate. In the US, this is a problem sometimes because our customers can't get to us when they first arrive. So in Europe, where they have kiosks at all arrival points, required by regulation, that's great, it's simple. In the US, sometimes you have to send somebody in the terminal to get help. But again, in Report 210, we listed a lot of different ways that people are now managing to get customers connected more quickly with the service company. The photo at the right here is the curbside reception of Wilson James at London Gatwick. People get dropped off, get immediately right with the service company, and then can be taken straight to the gate if they're ready to go. So we recently had a paper written on how to better assist passengers with vision loss, and this was done by Pat Pound, who's our IT consultant and who herself is blind. She worked with some other organizations for the blind or low vision in Texas. So the first thing when you meet somebody to assist them is let them know that you're wearing a mask. They're going to feel a lot more confident being closer to you at that point. And then always ask, but now asking is even more important because how people want to be guided is going to vary. Some people may want to still take your elbow, but they may want to have a glove on or a paper towel so that they're not directly touching your clothes. They may ask to take your shoulder instead. They may command a guide dog to follow you. They may simply want you to follow behind and just give them directions. Pat came up with another solution, which is to unfold her white cane, have the service provider hold one end of it, and she holds the other end, and she just follows behind. And she tested it out last week out in public, and it worked really well. So that's a good suggestion. We could even buy canes ourselves to have them on hand for travelers who don't have one. So as you're going through the airport, if people, if your hand sanitizing stations offer them. Again, at security, sometimes now we have to scan our own boarding pass. And so you're going to have to ask the passenger, what's the best way to help you with that? And restrooms can be very complicated for people. It's difficult to navigate. So companion family restrooms are a lot better. Describe where the different toilet is, where the sink is, and so on, so the person doesn't have to touch a lot of surfaces. The same thing is going to apply at the service animal relief areas. The less touching we do, obviously, the better. And blind people have to touch. It's their way of navigating a lot of the time. So The picture on the right here is the queue markers at 6 feet apart or 2 meters apart on the floor. Blind people can't see those, and the dogs don't even recognize cues. So these are always an issue for people with vision loss. Before COVID hit, we were doing our best to enable people to be more self-reliant, just because we could not keep up with demand. So one of the apps for people with people who are blind that's really great for travel is Aira. At this point, it's available mostly in the United States, but it is an app which connects a person through video from their smartphone and a smartphone to a remote agent, who then will give them directions. So this enables people to go through really complex environments like the airport without any kind of assistance. So more than 30 airports in the US now have this. The airports simply buy the minutes in terms of blocks. So perhaps after COVID, we'll see this expand again to the UK. The photo is of a young woman exploring the airport using her smart glasses. And she's actually in the check-in area and going on her own. So as I mentioned earlier, people with hearing loss have really been badly affected by the need for social distancing and for people to wear masks. So the more information we put out in advance, the better. Can we have see-through masks and shields available for our personnel if somebody needs to lip read? I don't see why not. There's various kinds available on the internet. If we need a quick fix like a counter loop, they're very easy to simply pop onto a counter. In Europe, hearing loops are common. In the US, we're just starting to get them now. Visual messaging is, of course, always important. At this point, we're putting up a lot more signage with regard to COVID. We're putting social distancing markings, and this is really important so that this group is also getting the message. Tablets with video relay interpreting are only being touched by the staff member, so we still want to see these at information counters. Something that you might not know about is the Big app, BIG, and it just makes the font really large. So whatever you're typing on your tablet or your cell phone, you can answer a question, type it out, and hold it up for the person to see, and they're likely to have it on their phone as well. And finally, airports and airlines in the United States are now beginning to create live chat services on their website. This is fantastic for everybody, a quick way to communicate by texting back and forth, but of course really important for this community. Shown on the right here is a counter loop at Rochester, New York's airport. So once again, self-reliance. Now we're doing it for social distancing rather than trying to deal with the numbers. But of course, when travel comes back, it's going to be important so that we can keep up with demand in the future. So can we provide wheelchairs for loan, whether it's available from the airport or the service company? Sometimes in the US, they just sit in the lobby and you can just borrow one, like in Orlando, or in the picture here at Cincinnati, Northern Kentucky. In Birmingham, they actually loan people electric mobility scooters. And of course, most of us have heard of WIL now, the WIL autonomous drive system. It solves the problem of mobility and wayfinding, but now it's also enabling social distancing. So WIL put out a press release on this just last week. And there's a photo of the gentleman here at Haneda using their wheelchair to go to the gate. The photo at the top is of wheelchairs for rent at the train station in Schiphol. So it's just for a nominal fee of like £1 or €1. Another way to enable self-reliance is to set up an electric cart transit system. So you're more socially distanced usually on a cart than you would be in a wheelchair. A lot of people would like to walk, but if they run out of energy, they can just sit down at one of these cart stops that's shown in the photo here at MSP, sit down and wait for the next cart, or they can scan a QR code or call a phone number if the need is more urgent. Some of the innovative equipment we've seen, non-metallic wheelchairs. This is wonderful because people do not have to stand up and walk and need help getting in and out of the chair, walking through the security machine. They can remain seated right through security. So All Nippon Airways, ANA, has a wooden chair. There's one that's polycarbonate plastic from Jet Wheels out here at JFK Airport. And then a third type is the morph wheelchair. Sorry, I misspoke. It's Japan Airways that has the wooden chair. All Nippon Airways has the morph wheelchair. The larger wheels come off, and then the chair can actually serve as an aisle chair and take you right to your seat. Another type of non-metallic device is the intelligent trolley. And we saw this at PTE a few years ago, thought it was great. It actually has its own scanner. So once the customer puts their cabin bags on, they scan their boarding pass, they can just go to security, feed it through its own scanner. They don't have to lift anything. They don't have to touch any of those dirty trays. And TSA now is actually asking for touchless screening devices. So perhaps this is going to work. So for older travelers, this also works as a walker. So it helps steady them as they walk. So again, maybe we can get more people to take a walk through the airport and do some shopping along the way rather than getting a wheelchair push. And then last week I saw something called C2Flex. So this is going to enable people to use their own mobility device, or their own mobile device rather, to check in and drop their bag. So it's already up and working at the SFO International Terminal with their airport kiosk there. So this really solves the problem for people who are blind, because the kiosks still are very difficult for them to use. One area which it's really difficult to social distance is, of course, the lift and transfers in and out of the airplane seats. So I just showed 3 different types of slings here. One is Eagle Lift by Haycomp. It rolls right onto the plane, and then you can lower the person into the seat. Much less personal handling. It's great for heavier travelers. The PTK kit shown in the middle is just a personal transfer kit with a transfer board and a sling. Very easily slips down behind the person's back, around under their legs, and then 4 people can again lift. But you're not have a lot of invasive touching, which for some people can be very painful. And then on the right is Josh Wintersgill from Easy Travel Seat. This is the sling that he invented. It's owned and rented by the passenger. They stay in it in their chair. It has a nice cushion. And again, you can get lifted in and out of your own wheelchair and into the seat very easily. And also it's great in terms of evacuation. Also in the news lately is virtual assistants. We're moving a lot more toward that to get away from face-to-face contacts. We found two of these different virtual assistants when we did the ACRP Report 210. One is Faceport, which is at Schiphol Airport, was created there. And it allows video conferencing from a remote agent who can then serve multiple locations. So it's cost effective. And she can do things like print a boarding pass, upload data from the passenger, and so on. The Tensator is another one which the TSA actually found initially and helped promote. It can even, you can even shoot a video for sign language. So it can communicate in multiple languages. Usually it's used at security checkpoints to get people ready for the security process and speed the line. And then, of course, there's wayfinding kiosks, which we talked about in Report 177 on innovations in wayfinding. Another topic which, it's not a quick fix, but let's think for the future about our vertical transitions. Right now, of course, people really don't want to go in elevators. So can we have a ramp instead between floors in future? Again, it's great in terms of egress if we quickly need to evacuate a building. Right now, the large flow elevators are really working well. If we can make them no touch, the way they are at London Heathrow, so that people, don't have to even push a button. It simply stops at all the floors. And then there's visual and audible announcements, so everybody knows where they're going. Wheelchair-only elevators I saw in Heathrow and other airports in Europe. Again, the elevators are a pinch point when we get back into a period of high demand. So here again, we're creating a separate route for our customers and now protecting their health a little better. The elevators at T5 at Heathrow even accommodate electric buggies, which is very effective when we need to quickly move a group of people. And always, if we can have platform lifts at gate stairs to get people down to the tarmac and out to the plane more quickly. And wheelchair lifts, we always love it at open doors because it helps reduce the damage to the wheelchairs and also makes for smoother, quicker operations when we're trying to turn around a plane. Disability-related amenities, best practices, of course, now we're totally into sanitation. So if we have, amenities specifically for people with disabilities, we want to make sure we clean them after each use. So to do that, we need to control, people going in and out. So either a reservation or an access code that the person needs to get to use the room, and then as soon as they leave, we know we can send in the cleaning staff. Better cleaning also, not just for all the restrooms, but especially the family companion restrooms, because these typically are used by travelers with disabilities. And whatever we can make touchless again, so much the better. So shown here are the adult changing room at London Heathrow. A wave door opener, where you just wave your hand in front of it. The first one I saw of that was up in Vancouver. And then down below is the air blade, which combines both hand dryer and water faucet. Another area we're seeing a lot of changes in which people who with disabilities really appreciate, especially people with vision loss, is the ease of ordering now and paying in airports. So at your gate is one food retail ordering system that will actually bring the product right to the gate. Grab is another that's a pickup service, and now that HMS Host is signed on with them, we're going to see it before long in more than 80 North American airports. In Edinburgh, Fetchy Fox was designed to be inclusive for people with disabilities. It's still in only one airport. We're seeing QR codes for restaurant menus and payment all over the country, and I'm sure we'll be seeing that in airports as well. And finally, the touchless checkout is now coming. I know Amadeus is already using Apple Pay with their Lufthansa client to pay for checked bags. Amazon's Just Walk Out is now being used by OTG. It's currently in 10 airports, but that's going to be increasing. The photo here is of someone scanning a menu QR code. So again, for people who are blind, they don't have to worry about the fact that the menu's on the wall or that they can't read it and have to have somebody read it to them. Now they've got it in their own hand. So last but never least is we really need to interact with the community to know that what we're doing is actually in line with what their needs are. So it's definitely the key to getting it right. So whether we reach out through virtual meetings now with disability advisory committees, whether we use social media, whether we simply communicate with the organizations in our own localities or work with an international company like Open Doors organization, it's really important that we hear and that we are inclusive. Too often when new technologies are purchased or implemented, their usability and functionality is overlooked. And so we see things like really wonderful, accessible biometric device, but oh yeah, we made the lane too narrow, so people with wheelchairs can't use it and now have to go and stand on or sit on a line and get checked manually. So that's the kind of stuff we want to avoid. Some travelers with disabilities also want to be fast streamed through the airport and go quickly to the gate. So the right decisions now are going to restore confidence, speed recovery, and help prepare us as an industry for when the demand comes back strong. And I know it will. People have not loved sitting at home and losing their independence. And I know there's definitely a pent-up demand in our community. I have 2 pages of resources here, which you can look at later, including our new report on guidance for airline service companies for people who are blind, and the 2 ACRP reports. And then finally, a quote, which I saw and thought I wanted to share today, because it really is definitely how we feel at Open Doors. The article was called, "I'm visually impaired. I don't want things to go back to normal." This young lady, Mila Gross-Costabel, writes that this pandemic is forcing society to make changes that should have been implemented a long time ago. When we enter our new normal, I want the best of our lives before to be mixed with these positive changes that we are seeing now, so that when all this is over, we can find ourselves with a more inclusive and fairer world. And amen to that. The next page, there's a photo of the old normal, which is a group of people sitting at T4 at JFK, all sitting in wheelchairs, all clustered together, waiting to get on a flight to Dubai. And obviously that's what we're trying to avoid now, but we definitely want the numbers to come back. and try as much as possible to to provide just-in-time service. So we're going to go to the question and answer period now, and thank you all for your kind attention.
That was incredible, Laurel. Thank you very much. The work that you and Open Doors do is absolutely incredible. Laurel had mentioned the ACRP report 210, Innovative Solutions to Facilitate Accessibility for Airport Travelers with Disabilities. It was published earlier this year, and Laurel and the entire team at Open Doors spent well over a year putting together so much valuable information, and I think that it really showed through in her presentation today, just the breadth of knowledge and information that they bring together. If you have a question, I see Carrie Ann Wilson has a question, so I will go to Carrie Ann. And when you want to ask a question, there's a little icon in the upper right-hand corner with a hand. And when you push that, I can see that you're wanting to ask a question. So I'm going to go ahead and go to Carrie Ann now, and I'll then wait for someone else to ask a question as well. Carrie Ann?
Wonderful. Hi there. I'm Carrie Ann Wilson from Air Canada. Laurel, thank you so much for this presentation. I was wondering if Open Doors has been consulted by various governments around the world to look into these proposals and these solutions, whether IATA has been reaching out. I'm very curious about what the measures are currently within the industry, and I don't know if you can shed any light on that.
Yes, William, can you hear me?
Yes.
Okay, good. Yeah, so we are actually working closely with IATA. We're a working partner of theirs, and we were, of course, very active over the last few years with Linda Ristagno, who's actually on the call today. And we just this week have decided to do some online training with them, as well as some other e-learning courses. So yeah, IATA, and I don't know if I'm speaking out of turn, but they're actually working on guidance with regard to passengers with disabilities right now. So in addition to the guidance they put out in conjunction with ACI, they're going to be putting out a more specific report. So across the board, there's not a lot in what the guidance has been from the international organizations, beyond saying that we do need to accommodate everybody. We need to make the exceptions. And that can be a bit thorny when other passengers are getting upset about seeing somebody without a mask, for example. But we need to set up our policies, make sure we're consistent so that people can come out to the airport and not worry about whether their needs are actually going to be met. So I know that also people from the DOT or FAA are on the call today, and we work closely with them and also speak at their conferences normally. They actually come to our ACR workshop as well. So we are trying to have the input across the board if possible.
Great. And I see that we have Linda's hand up now, so I'm going to go ahead and open up the floor to Linda Ristagno with IATA. Linda?
Yeah, hi, William. Hi, Laurel. And good afternoon, good evening, everyone. Yes, I just wanted to echo what Laurel was saying. And indeed, we are reaching out as IATA, we are reaching out to different organizations, and Open Doors is one of those that we are working with. But also, thanks, Laurel, for sharing the recommendations or the guidance, let's say, from PAT. It was very interesting. And we are also working with the Accessibility Working Group to look at some of the policy that, well, this is the intention. This has been raised by the working group to see whether there are policies that we can look at. And so work ongoing, basically. Yeah, thank you.
Thank you very much, Linda. So with that, we are going to go ahead and wrap up today's session. We'll be very happy to provide the session to everyone, both the recording and the slides in the coming days, especially the recording. If you had colleagues that weren't able to join today, they would be able to actually go back and listen to the entire event. I would like to thank Laurel and Open Doors for providing such valuable content today, and also thank all of you for all of your attention and continued support of the sessions.